So the other in the front where the Indian wants to just then the other side. Even if that thing had been road completely out of repair,
Yeah, we don't you won't regret. It's life that brings it.
The resident district commissioner who is here and representing the central government, the district chairperson who represents the entire district, and that is the community, the Honorable Secretary for Health, Education and Community-Based Services, who is in charge of these three departments, but particularly for now, the health department, the Assistant Inventory Management Officer, colleague from National Medical Stores, you come along here. Today I'm privileged to have ourselves again gathered together. Remember, we last met here for the same cause on the 1st of July when we received the last consignment for the previous financial year. Today, we received a consignment from National Medical Stores, and these consignments are for the lower level facilities. That is the health center 2s and 3s in Kitgum district, including the military facilities like the Budwong, military, Romtikau, as well as police and prison health center 2s. To me, this is something that is good for the population, because it is exactly the space of 2 months from the time we last received our consignment. And within this consignment, one thing that's important to note is that we have the anti-malarials, both injectables and oral, which we think is going to help us treat malaria, since we know that the top cause of sickness within the district is still malaria. If you go to the facilities, up to 43% of outpatient attendance is due to malaria. So this is a good call, and I would like to appreciate the district leadership, first of all, for giving us this enabling environment that made our supply chain team request for these medicines in time, and that's the reason as to why, amongst other districts in the county, we are able to receive because of the procurement planning and as well as the request for this consignment is concerned. So thank you so much, District Chair and the entire team, for giving us that courtesy. I would like also to appreciate the central government representative, the RDC, for the oversight role that has always been played, as far as making sure that our cry for medicine is listened to. I'd like to thank my Secretary for Health, who has always been with us, giving us guidance and making sure that we have whatever is required for the community in time. On a special note, I would like to appreciate National Medical Stores for the timely delivery of medicines for the first cycle. I still request that this should be the trend, so that at the end of the day, we do not have a lot of stockouts because of delay in delivering consignments to our facilities. And I also request that for the health center 4 and the hospital, their deliveries should be timely, so that at the end of the day, we should be able to sustain this. With these few words, I would like to thank each and every one of us for this witness of the essential medicine. This forms part of the public accountability. That is the responsibility of all the stakeholders. Thank you so much. Honorable Secretary for Health, I invite you to say some few words later on. You also invite the district chairperson, who will in turn invite the RDC to give the last.
Thank you, DHO. I'd like to take this time to appreciate the presence of our representative from central government, that is the office of RDC, district chairperson who is here in person, our DHO representative from National Medical Stores and the media team is here with us. I really don't have much to say. I'm very much privileged to come and witness and then confirm that our first consignment of this financial year of the drugs or the medicines of this Kitgum district local government, especially the lower health centers, that is health center 2s and then health center 3s of Kitgum district local government, that they have reached, and we have really confirmed that they are here. It is our highest appreciation to National Medical Stores, the government of Uganda through Ministry of Health, that our people are going to receive, especially the anti-malarials, which in the last cycles we didn't really receive. We appreciate you so much because in our trends, the most prevailing disease right now is malaria, given even the weather and then the season that we are in. I'm happy that our people are going to get the right medications at the right time. We really hope that this trend is going to be maintained such that we maintain also the way how we are going to deliver to our community. I really don't have much to say. At this juncture, I would like to welcome our dear chairperson to have a word. Thank you.
Yeah, thank you so much. The RDC with us, the Secretary Health District Local Government, Kitgum, the DHO, and then the medical store team and inventory management and media. To me, as a district chairman, this is a it's really an opportune moment to witness. This is the arrival of our essential drugs in the lower health facilities for use in the district. It is very, very appreciative to be witnessing this because this is generally a sign of life coming for our own people. And indeed, I'm really overjoyed. I want to start by appreciating the National Medical Stores team who have endeavored to ensure that they stick to their schedules because the delayed delivery of essential drugs is a disservice to our health and a disservice to the entire community. But if they stick to their schedules the way they have done today, I think we are overjoyed as leadership came there. And we can imagine the last consignment came on the 1st of July. Only 2 months from that date, we now receive another consignment. This is the way to go. On our part as district, together with Office of the RDC, we have a very big role to ensure that these essential medicines are put to the right use. They must not in any way be misappropriated or channeled for other uses, apart from serving the public. And I think this is focus for the entire team, whereupon we shall sit down on a drawing board and plan how we can monitor the usage of these essential drugs. This same appeal goes to the entire health facility team to ensure that whatever they receive, they should use it for the benefit of the population, not to mess up with with the consignments for other purposes. I think as a district, we shall ensure that we focus and monitor very closely how these medicines are consumed. But again, on our part, we shall continue also to lobby with the national medical stores to ensure that the streamlined schedules are adhered to. That is our role. So, ladies and gentlemen, I'm so appreciative. And I think the community outside there also joins me in appreciating this consignment. The next thing we are going to ensure is that all these consignments reach their definite places of destination. And around of it all, we shall ensure that all is in place and then they are put into use. Other than that, I want to appreciate everybody who has been in attendance here. And I just want to hand over to the RDC to also give his quick remark. I thank you.
Thank you, Chairperson, Honorable Member of the District Council, DHO, and the team from National Medical Stores. As the representative of central government, I'm really privileged to be here this afternoon as we receive the deliveries of drugs for the health center 2s and health center 3s, where even police, prisons, and DPD are supposed to get. I want to thank government so much because this time around it is timely, and I know our people will appreciate. Even the other one of malaria has come, and we need to utilize them well. Uh, I also need to emphasize that let our workers in the health centers do their work well. This business of representing themselves in the name of having no drugs. Drugs are there now. Please let us perform well and deliver our expectations. Then lastly, I want to say that let us guard against both external and internal thieves. These ones who will be wanting to steal these drugs, both internally and externally. Internally, I mean these people who are working. Externally are these ones who are organizing to come and break. So let us guard jointly against these people who will want to steal these drugs. These drugs are not to be stolen. These drugs are supposed to be administered to the patients. So those ones who will be listening to us, please make sure that if you get even some information which can help us against these other things, please give us, give us. Otherwise, we thank government, we thank each and every person, and we believe that this thing will go to treat our people well, and our people will also be proper. Just like it is in the manifesto, delivering education, health, and water. This is the way to go. So thanks go to the government. I thank you so much.